Okay, so firstly, good morning to all the delegates, presenters, and the organizers of the Rural Health Conference. As Warren has said, my name is Lauren Tones, and this morning I'll present on bowel and bladder problems in people with spinal cord injury in Manguzi, and I'll be looking at both the experience and long-term needs. Spinal cord injury is a chronic disability that affects all domains of life, namely physical, social, and well-being. Besides the loss of mobility, people with spinal cord injury experience secondary health conditions such as pain, pressure sores, spasms, partial hypertension, pneumonia, and then bowel and bladder problems, which I'll be discussing further in this presentation, as well as mental health problems. So there's evidence showing that the prevalence of bowel and bladder problems are quite high, and that UTI is one of the main reasons for readmission. A lot of studies based on these issues have been done in urban settings and none in rural, to my knowledge. And studies looking at the experience of long-term needs related to bowel and bladder problems in people with spinal cord injury in rural settings are very scarce. So the aim of my study was to explore the experiences and long-term needs of bowel and bladder problems amongst people with spinal cord injury. The methodology I used was an exploratory qualitative study. My setting was in Manguzi. I had community dwelling persons with spinal cord injury older than the age of 18. My inclusion criteria was quite simple. They had to be above the age of 18, diagnosed with a spinal cord injury, irrespective of their level, duration, or duration of their spinal cord injury, or the severity of it. I used semi-structured face-to-face interviews, and I had an interview guide that helped me with this. And then in terms of my data analysis, content analysis was done. I read and reread all of my interviews. They were manually coded, and I did thematic analysis. So I interviewed 12 people with spinal cord injury, and basically this table of my results. So it's showing basically a lot of my information, but what I want to highlight is that most of my participants were male, 83% of them. Most of the participants were unemployed, also 83% of them. And then in terms of the spinal cord injury profile, 92% of my participants were paraplegic, 92% of them experienced pain, and then the main cause of spinal cord injury was trauma, and that's 67% of my patients. So the main theme that emerged from my bowel and bladder theme was no control and frustration. And these are just some of the quotes that had come from my analysis. The types of bladder problems that were highlighted were urinary tract infections, incontinence, and urine retention. The types of bowel problems that were highlighted were diarrhea, incontinence, heartburn, and constipation. The management for bowel and bladder problems from the participants themselves. For bladder, a lot of them said they used catheters or nappies. They used some form of medication, and they were drinking a lot of water. In terms of the bowel problems, 1 or 2 of the participants made use of a stoma bag. A lot of participants used gloving as a method. They definitely used nappies and then some form of medication. One participant in particular highlighted the use of traditional medicine. And I think that was quite nice, just to know that not everybody was dependent on actual pharmaceutical intervention, and that they relied on, he mentioned a plant that he used, and he boiled and he put it in water. So that was nice to hear that he found an alternative method for himself. And then diet, a lot of them mentioned that they were very aware of their diet and what they eat and how it controls their bowel. In terms of the impact of bowel and bladder problems, from the analysis, what I gathered was that a lot of the participants mentioned how it affected their relationships and social lives, their finances, because things like nappies were expensive, their mental health, as well as the time, particularly emphasis on how long it took them to do bowel and bladder management. These are just some of the quotes that I extracted from my analysis with regards to some of the themes. In terms of the long-term care needs, what had come up from my analysis was the need for information, medication, proper toileting facilities, and access to quality catheters. One participant in particularly mentioned that good quality condom catheters would be great because the challenge, particularly for him, was that they don't last very long. So a better quality condom catheter would make his life a little bit easier because he wouldn't have to keep having problems with them. He said after a few days, it just becomes problematic for him. So in essence, the experience of both worry and frustration due to bowel and bladder problems supports what has been reported in previous studies. And people with spinal cord injury are concerned about leaking and embarrassing themselves in social settings. These secondary complications impact their well-being, their personal time, as well as their finances. And although all the participants knew how to self-manage both their bowel and bladder problems, they still found it very challenging. The cost of nappies, access to adequate catheters, and medicine was a challenge that really needs to be addressed by our healthcare system. And I think for me, the study just confirms the need to strengthen long-term care for people with spinal cord injury, specifically for bowel and bladder problems. And in terms of my recommendations, lots of health education on bowel and bladder problems, as well as management, during both their hospital stay and in their integration back into community phase. So from the data analysis, I found that although they knew, they always felt that there was room for more education, refresher, and new ways. And they liked the idea of having a peer support group because it was often easier to speak to people who had similar challenges to them. And then access to medication. So Dalcalax was one of the main things that was mentioned to help with the relief of constipation, as well as other ways to relieve constipation. So particularly with the one participant who mentioned the use of the traditional herb plant that he uses. And then obviously the need for quality catheters had come out of my analysis as well. Thank you so much. Yeah, that's pretty much the first of my 2 presentations.